Finally, we need to adopt and enforce an effective anti-discrimination law. We need to recognize the multiple forms of discrimination that occurs. Intent is not the most pervasive form of discrimination. I would say that reckless and negligent discrimination is more pervasive, and yet the law doesn't address that. We need to authorize the fund the use of medical testers. Medical testers are people who go in for the purpose to see if discrimination will occur. In housing, what you do is you have people, it's very simple and straightforward. A person of one race goes to rent a house, and then the person of a different race goes to rent the same house, and see what happens. We need to look at whether or not there's a way we might be able to use medical testers for the same in the same way. Now, it's got to be authorized, because by law, if you don't really intend to get the service or rent the house, then you haven't really been harmed when they say no to you. The law needs to authorize the use of medical testers so that you can sue based on their on what they find. We need to allow both individual and organizational right of action. Now, in this case, what the problem is that the law requires that an individual identify that they've been harmed or injured. And the problem in healthcare and in many of the systems, is that the discrimination is hidden. Just like the bias is hidden, the discrimination is hidden. And there's no way for the individual to know it at the time or even ever. But an organization can collect data and monitor what's happening. Except an organization doesn't have standing, that's the legal word, and without standing, they can't sue. To have standing, you have to be injured, or the law has to authorize it. Now, we have authorized organizational standings in other places. For instance, we allow Greenpeace to sue on behalf of the environment. And so in fact, there's whole articles written about do trees have standing. If we can allow Greenpeace to sue on behalf of the environment, we should be able to allow different organizations to be sued on behalf of the community based on this negligent, implicit discrimination. And finally, we need to be sure that we have adequate fines and regulatory enforcement. If we've learned anything from this crisis, is that without regulation and without enforcement, organizations will tend not to do the things you want them to do, but to maximize their profits and their individual profits. Now, the problem with Obama's approach, which he says he's going to invigorate the enforcement of existing civil rights law, the problem with that is existing civil rights law is inadequate, and as a constitutional lawyer, he knows that. He knows that you can only get into court with intentional discrimination. He knows that you have to have an individual who knows they've been injured to be able to get into court. The current civil rights law is inadequate for addressing 21st century discrimination, and what we need is a new anti-discrimination law for the 21st century, and not one that just patches current discrimination law. So how do we influence healthcare reform so that it is multicultural, universal, comprehensive, targeted? In closing, W.E. Du Bois said that the problem of the 20th century was the problem of the color line. In the 20th century, the color line was overtly and legally enforced. Here, at the beginning of the 21st century, the problem of the color line continues. Not only is it institutionally and structurally enforced, but there is a big push to claim it doesn't exist, to be colorblind. In the absence of laws and policies and practices and reparations that address institutional racism, systemic racism, colorblind racism, and discrimination, the problem of the color line in healthcare and in all other systems will continue for another 100 years. Thank you.